And there we go. So, Chris Burres, you have the dubious distinction of being the very first person that on my video podcast. This is actually a podcast, but I've never done a video interview before. So this will be live on YouTube, and then the people in podcast land can listen to us and then jump over to YouTube and watch us. And, you know, because people have said to me in the past, Joe, what do you look like? And where are you recording from? And I'm like, well, I can record from anywhere, but today I'm right here in my office at home. So,
and he's got the Shoney's or the big boy in the back. I love that, the character in the back. By the way, I did at one point transition from a podcast to also doing video. So let me give you a head start here. Make sure you subscribe and follow, because you want to get more of what Joe's putting out.
Yeah, absolutely. Yeah. Yeah. So, very good. Thank you. So, so Chris Burres, so you have one of the most interesting anti-aging compounds that I've come across in over 25 years of investigating anti-aging supplements, and we'll talk about the supplement aspect of this in a minute, and other things. And one of the things that made me interested to bring you on board is that you've been very honest about what this product does and the research behind it, and a lot of the other stuff that goes around, like the shenanigans and that kind of surrounds this compound. So basically, your product is My Vital C, and you are spearheading and actually have research on your molecule, which is called C60, carbon 60, sometimes known as fullerene molecules or buckyballs, all kinds of stuff. So that's what we're going to talk about today. If anybody has not heard about this before, it's actually a very, very interesting compound. We're going to talk about the research on My Vital C, carbon 60, and a whole bunch of other things, because I've got a list. I've got a 2-page list in front of me of questions to ask, not only questions that I want to know, but questions that my friends have asked me too. When I said, what do you want to know about this stuff? And they gave me a list. So before we go any further, Chris Burres, what the heck is My Vital C Carbon 60? Tell us about this for those who have not heard of this before.
Yeah, absolutely. So carbon 60 is the third form of carbon. We're all familiar with diamond. We're familiar with graphite. That's in our pencil. And then there's now a third form of carbon that was discovered in 1985. It was discovered by 3 professors, Dr. Smalley, Dr. Croto, and Dr. Curl, at Rice University here in Houston, Texas. And they discovered it in 1985. They published an article in Nature magazine, the most prestigious scientific publication. And then they actually won the Nobel Prize in 1996 for the discovery of this molecule. The best way to understand what this molecule looks like is to be a subscriber on YouTube and see what I'm actually holding up. But since this is a podcast, I will describe to you what I am holding up. It really is, the best way to think about it is, imagine just for a second a soccer ball. And then the lines on the soccer ball represent the bonds between the carbon atoms. So you have the spherical molecule of 60 carbon atoms. And I'm holding up actually like a chemistry model of a buckyball, a carbon 60 molecule. And again, it looks exactly like a soccer ball, except made by a chemist, not by a leather manufacturer. What's amazing about this particular molecule, and some of the reasons that it won the Nobel Prize really quickly, I like to say that it performs as well or better than the current best material in almost every application. So it's superconducting. It's harder than a diamond. It'll actually turn into a diamond. It's got 6-fold symmetry. So there's 6 planes of symmetry on this buckyball, which gives it an insane amount of resilience. You can actually fire this buckyball at a stainless steel plate, and most molecules will just shred to pieces. This one will just like compress and bounce right back. So it's incredibly resilient. That resilience is actually really important when you start talking about things like it does have the ability to hold electrons and then release electrons. That's a nice property that you would like to have in a battery, right? It's cost competitive with lithium, so we might actually see Bucky batteries at some point. The other thing the reason that they won the Nobel Prize is one of these sides, and actually there's a bunch of them on this buckyball, but one of these sides is the exact shape of the benzene ring. And the benzene ring is a necessary, this is no understatement. It is a necessary component of modern society. So if you look around wherever you're at, unless you happen to be listening to this podcast in some remote wooded area, wherever you're at, look around and notice everything that's plastic, right? Without the benzene ring, those things do not exist. right? Benzene is in most medicines, it's in most detergents, it's in all plastics. So it's a ubiquitous material in our society. So this buckyball, again, I'm holding the buckyball up. The buckyball has a number of benzene rings around the outside, and the chemistry that works on the benzene ring actually works on the exterior to a large degree on the exterior of the buckyball. So they're like, hey, great, benzene, ubiquitous, necessary for modern society. Buckyball, 3D version of benzene. This is going to be really important. Those guys should win the Nobel Prize. And they did. And they won it in a short 11 years because the scientific community really understood how valuable this would be. Now, when you have a molecule that's going to be this ubiquitous, it means that people are going to work with it, right? And they're probably going to work with a lot of it. It turns out that benzene is a carcinogen and a known toxic substance. And so they actually assumed that the buckyball would be a carcinogen and a toxic substance as well. So in 2012, really that's when it was published, but they published a study out of the University of Paris. And in that study, very proud, they used our material in that particular study. And really they were, again, it was a toxicity study. They assumed it would be toxic. So they gave rats water, they gave rats olive oil, and then they gave rats olive oil. And really here's where I like to start making a distinction. C60 and carbon 60 is for industrial applications. There's peer-reviewed published research that shows if you improperly process C60, it is harmful. Be careful. ESS 60 is C60 that's been processed for safer human consumption. So back in that study, they gave rats water, rats olive oil, and then another set of rats olive oil with ESS 60, which happens to be the MyVital-C formula. Instead of being toxic, the rats that they gave the olive oil with ESS 60 in it lived almost twice as long, and they died without tumors. That's actually the single longest longevity experiment on mammals ever. And Joe, I think you've been kind of looking at longevity. You mentioned like 25 years, significantly longer than me. I mean, I've delved in and I get paid, and everything I do all day is talk about it and read about it and learn about it. But you have a longer kind of span in the industry. Like, what is your kind of take on, hey, here's this particular study?
Yeah, and so since you brought it up, I'm looking at it right here, and what got me interested, again, to bring you on, is the wording they used in this study. The title of the study was, and I'll just read it for people who have not heard of the study before, the prolongation of lifespan of rats by repeated oral dosage of C60 fullerene. I don't see words like prolongation of lifespan very often in clinical studies. I've read my share of clinical studies over the year, and a whole bunch of other people's share of clinical studies. The other one that got my attention, which came out about the same time, which didn't have the sexiest title, which was possible mechanisms of fullerene 60 on antioxidant action. But what words they used in the description of the study got my attention. Again, geroprotective, gero referring to gerontology, the study of the aging process protective, and the other phrase, retard senescence, again, another reference to old age, something that could retard aging. Those are words I normally don't see very often in clinical research. Again, they're rat studies, but the words they use, again, jumped out at me enough that I said, let me look into this more and look at the science behind it. Again, and again, there are some other studies. I actually saw one just actually before we got on this morning, which actually came out in 2018, where they were talking about some other stuff with this, with the carbon 60 as well. So research is coming out all the time, and again, I'm all about the research.
Yeah.
And even though it sounds like we're almost at the frontier of something big right now, I wanted to get ahead of this and try to explain it to people, help you explain it to people. So when it does start, blowing up, people, have a place to go where they can get some honest answers about this.
Yeah,
so,
to really get some good information. Yeah. And I think, and you can probably co-sign this, in my awareness, the next best way to live longer, although it is more researched, right? So there's more research about calorie restriction, also sometimes colloquially called CR, calorie restriction. And calorie restriction, if you restrict your calorie consumption, by 30% from what you're supposed to eat. So that may not be where we're at today, but take where you're supposed to be at for your BMI and then reduce that by 30%, you can actually get a 30% extension of life. And that's very repeatable. It's repeatable in multiple models, rats, mice. I don't think they have it in humans because, again, remember, in humans, lifespan studies are a problem. They're a problem.
Good problem.
Yeah. The average lifespan about 80 years. So if you're talking about any sort of extension, you're talking about an 80 plus, potentially 80 plus year experiment.
Right.
And so, I don't know if you've got any feedback on, you don't see those words very often, but when you see them, they're usually related to calorie restriction. And now that's kind of folded over into intermittent fasting. But intermittent fasting doesn't even have the results either, at least not that I'm aware of. It has, hey, when we do calorie restriction, these blood markers look like this. And then when we do intermittent fasting, those same blood markers look the same. So we're going to draw a parallel and say intermittent fasting should have an equivalent, extension of life. But I don't think there's the comprehensive studies on intermittent fasting that in terms of lifespan extension that exist for calorie restriction.
Yeah, there's not. We live so long, which is a good thing. So it would take a Framingham-like study to actually look at calorie restriction and life expectancy and life duration. Again, even some of the research on calorie restriction, intermittent fasting is starting to show that maybe it's not so great on our LDL levels, which again, that's a discussion for another time. But again, one of the things I'd love to see maybe for going forward would be maybe even to look at my vital C compared to calorie restriction. But again, maybe a conversation for another time. One of the things that people had said to me when I said, what do you want to know about this? People continually said to me, I'd like to know more about the C60 supplement. So elephant in the room, is this a dietary supplement?
So it certainly falls into a supplement from a number of perspectives. Okay. One, it's olive oil, right? So a high quality olive oil is actually that's just a nutritive ingredient. Right. And then C60 is a naturally occurring material, so it does fall into the class of a supplement. I think what you're kind of talking about is where does the FDA sit on this thing? And what's interesting, I'll tell you, I took a screenshot when we first. Well, let me take a step back. So 2012, this study comes out, and these rats live twice as long. And then people like you who can kind of read the studies, who have been looking at the studies for a while, are like, maybe I want to put that in my body. And I'll be honest, I did take some back in mid 2013, but not much. And I wasn't highly motivated to put it in my body like a lot of biohackers are. Like kudos to the biohacker community. In mid 2013, we started getting phone calls and people were like, well, how much in a dose? And think about like where I was. I'm a carbon nanomaterial scientist. We put this in paint and tires and solar cells and batteries. That's like saying how much in a dose of lithium, although I guess they do use that as a psychotropic drug, right? But we actually in mid 2013 added to our labeling not for human consumption because again, C60, there was peer-reviewed published research that showed when it's improperly processed, it's harmful. And then anything that I would call ESS 60 was safe. Like they injected it subcutaneously. They had rats inhale it. Like every iteration of properly processed C60, again, ESS 60 showed safe, but we're still, again, carbon nanomaterial scientists. I'm not going to tell you to put this stuff that I would put in my car tire into your body. So we added not for human consumption, and we still continue to sell the ESS 60 in oil, and for research purposes only. Again, clearly labeled not for human consumption. Fast forward to 2017, and a guy with a really huge YouTube following started talking about how he was taking it and getting all the benefits that he was getting. And the industry sold out, like everybody sold out except for us, because we're the largest manufacturer and distributor of ESS 60 on the planet. It was actually during Hurricane Harvey, and so there were like 4 days that we couldn't get to the office actually, but we never sold out. So really now think, okay, I'm a carbon nanomaterial scientist. Everyone's clamoring for this supplement, and you come into 2018 and I'm like, well, what are we going to do with this? I'm an entrepreneur and a scientist. This is obviously some sort of opportunity that I can marry both. And so I had to ask myself, I asked myself two questions. The first was a moral question. I take it, my wife takes it, everybody on my team takes it. I'm comfortable selling it. And that's like first and foremost. Like if I'm not going to take it, I'm not going to sell it. And then the next is the FDA and the FTC. So really when we come into 2018, I'm doing this FDA research and I come to an FDA page and it says literally on the page, you do not have to prove that something is safe before you put a supplement on the market. I took a screenshot because I'm like, this is going to be removed tomorrow or something. And then when you start to think about it, all right, so let's say Joe decides to get in the supplement business. He says, I'm going to put 10% vitamin C, 80% vitamin D, and 10% vitamin E. You've actually created a new supplement. Now, new supplements, such as I just described, are created daily, if not hourly. And there's no way that they can go through any sort of FDA process to be pre-approved prior to going to market, right? And so that's where the FDA sits on it. Now, it is our obligation, it would be Joe's obligation in this case, that if any serious adverse effects were ever reported, then he would need to share that with the FDA. That's the legal requirement. We've never had to share anything with the FDA. Most of, if we call these negatives, it's an olive oil product. Some people, when they take a teaspoon of olive oil, it doesn't sit well on their stomach. Also, a good quality olive oil will leave a peppery flavor in the back of your throat. So those are the types of complaints that we get. Also, we get a complaint that if people take it too late in the day, it'll keep them up. Other than that, those aren't what are called serious side effects that need to be reported to the FDA. So I think that kind of addresses like that. Is it a supplement? Yes, it's a supplement.
Is it found in food? Is it found on Earth? Because one of the things that people had said to me is it's found in outer space, and I saw some references that it's found inside stars and maybe asteroids. And is it found in food?
So if you collect the soot from a candle, right? Basically, you would have a candle, and then usually you would take like a cold plate to collect the soot from the candle. You can find parts per million of buckyballs or carbon-60 in that soot. So very low quantity. So it is very much a naturally occurring molecule. It doesn't, if you want to make appreciable quantities, then you do need to do it in some sort of reactor. What's very important is like we have this distinguished, like, is it a synthetic hormone or is it a real hormone, right? There's a big difference when the molecules are incredibly complex, right? So these hormones have all these arms and they bend to the right and bend to the left. You can make the exact same molecule that has a right bend instead of a left bend, and then a left bend instead of a right bend. And although the chemical composition is identical, they can react differently. One is synthetic, one is how your body makes it naturally. In the case of the buckyball, again, I'm going to hold this buckyball up. Again, imagine a soccer ball. It doesn't matter if you catch it in a flame or if you catch it in like our carbon arc reactor. It's exactly the same molecule. There's no opportunity to have a right bending or a left bending. It's literally 60 carbon atoms in the shape of a soccer ball. So we, in order to make appreciable quantities of it, by the way, my company is the first company to ever deliver appreciable quantities of carbon-60 to researchers around the world. And actually, we've been doing that since 1991. In order to do that, you really do need to use a reactor to make good quantities.
Interesting. Yeah, the reason I asked if it was a supplement and whether it was found in food is, yeah, the supplement companies are kind of they're on the honor system, as I like to say, when it comes to this stuff. They do have a little bit of a stipulation, though, that if something is not kind of consumed in food a lot, that may be a little loophole for the FDA and the FTC to be like, whoa, what's going on here? So maybe in your off time, when you do get off time, I'm sure you don't have much of it, look up new dietary ingredient.
Oh, we're familiar with that process. We've got consultants about GRAS, generally regarded as safe. Yeah, we're all over that, and it's a complex, interesting environment, and it gets even all the more complex and interesting because we're a nanomaterial, and the FDA struggles. They actually kind of have no idea, like they just throw their hands up. So when you're talking about GRAS certification, really. Are a bunch of scientists gonna certify, right? So GRAS is generally regarded, I don't want to get too much in here, but is generally regarded as safe. So basically a bunch of scientists who would have the right kind of background to give a good opinion about something. they would say it was safe. Like, and if you can prove that, then you have GRAS certification. The challenge is that most scientists have no experience with nanoparticles. And so GRAS is something that you've got to work towards. And actually we're taking steps and investing in the right technologies. So normally in order to get GRAS, there's a battery of tests that you need to do. We're already doing those tests. Really, a lot of them were done in that original rat study, but you got to do them and publish them in a very specific way. So we're doing those tests in order to kind of satisfy the standard GRAS assumptions.
Good. And those original studies from 2012, 2013, they used your product, didn't they?
Yeah, I'm very proud of it. So I can literally say that our product extended the life of rats by 90%. And we didn't dwell on this very long. I think it's worth talking about. So they use Worcester rats, and a typical Worcester rat dies at about 32 months, and they have a known amount of tumors. And if you're watching, I'm drawing this curve that goes up in space, right? The longer the rat lives, the more tumors they have. And even though the rats that were given my product, the MyVital-C formulation, lived 90% longer, they had no tumors, right? And that's a pretty profound, my director of research once said that particular Bati study, the University of Paris study from 2012, was really complex enough. It could have been 5 different studies. They injected the rats with carbon tetrachloride, right? That's a known oxidative poison. And the rats given water, so the control group did not react well, ultimately passed. But the rats given the SES60 molecule with olive oil actually were showing recovery before they were euthanized and then autopsied. That's the process of a carbon tetrachloride test. So there's a lot of amazing things that came out of that original study. And you know, I always like to, it's very important to be careful. As soon as you say, oh, they didn't have any tumors, a lot of people are like, oh, anti-cancer. There's a big difference between being a cancer preventative and being a cancer cure. If this is metastasized, you're just talking about a whole different kind of target. Although there's some very good research that shows that the SES60 molecule improves the efficacy of anti-cancer drugs against cancer cells and actually protects healthy cells from anti-cancer drugs, right? So anti-cancer drugs are typically a poison designed to target a cancer cell, but they usually affect healthy cells, hair loss, et cetera, that we're kind of familiar with. In a Petri dish, in the presence of SES60, that anti-cancer agent actually increased how much cancer cells had killed and actually had protective effects of the healthy cells. So pretty amazing result. Back to this, you know, no tumor. Being a cancer preventative is very different than being a cancer cure. We know that like good exercise, good sleep, a good diet are cancer preventatives. And that study certainly has strong implications that SES60 is a good cancer preventative.
In that 2012 study with the mice, did they give them the SES60 when they were baby mice or older mice, middle-aged mice? Did they give them throughout the lifespan, or they start at a certain age? How did that work?
Yeah, that's a great question. I suspect you might know the answer, but that's a great question. They actually started at month 10, right? So a typical Worcester rat, again, about 32 months. So about a third of a Worcester rat's life. They started at month 10. They dosed heavily. I think it was every day for the first 2 weeks. And then they did every week for the next month. But ultimately they only dosed the rats to month 17. So from month 10 to month 17 at a decreasing rate of dosage is when they dosed them. And they stopped at month 17. So this is kind of the amazing thing. By the way, they stopped because they were gavaging the rats. That's when you actually put a tube right down into their stomach to make sure that they're consuming exactly what you want them to consume, so you can understand, again, that toxicity. The reason they stopped is around month 17, the first control rat died. And it's known that gavages can have a negative impact on rat health, right? If you hit the wrong tube, then the rat dies. So they stopped the dosing then. And so even though their last dose was month 17, again, the rats given our formula lived all the way out to month 62. That was the average of the rats that were given the MyVital-C formula.
Okay, that's good. Yeah, you actually put the thought in my head, because one of the original criticisms of calorie restriction is, oh, you have to start it when you're very young. That was one of the original, I mean, way back in the 80s when we first started talking about this. And now we know, it appears to have some health benefits even later on the lifespan. So I started wondering, could the same benefit be applicable to this molecule as well? Prior to the 2012 study, was anybody thinking about this as an anti-aging thing, or did this 2012 study just come out of left field, like, whoa, this is anti-aging? But were they thinking about that prior to that?
Well, so it's interesting, right? Because the scientific process usually starts with anecdotal information, and then that leads to some sort of hypothesis. In this case, the hypothesis was that it was actually toxic, right? They just assumed this was going to kill the rats. And in that process, by the way, kudos to those professors, because you can very safely say that something is non-toxic when you give it to a group of animals and they outlive the control group. Literally at that moment, when all of the rats that were given water have passed, you know that this material is not toxic. So you could very easily just publish your results and say, not toxic. But instead of doing that, they actually did the proper animal husbandry for the next 2+ years, right? Because you went from month 32 all the way out to month 62. So another 30 months of animal husbandry on these rats. Ultimately, they were down to 2 rats. One of the rats passed, and they're like, okay, we're just going to euthanize the last rat, and we want to publish our study, which should have been published 2.5 years ago, and now we've got the data and the complete data in order to publish it. By the way, I think you bring up a very good point about calorie restriction in this. If the implications of the study are parallel to humans, and that is something that we can actually debate, then yeah, you could be a third of the way through your life and start taking this, and then take it for less than a third of your life, and then experience a 90% extension of life, because that's what I just described is exactly what happened to the rats in that study.
Interesting. And I'm sure everybody's thinking about the same thing I am right now. What's the mechanism behind how this thing works? I mean, I've heard, one of the phrases I heard is, it acts as though it's a free radical sponge. It's a giant antioxidant molecule. Is that still the prevailing theory? C60 works like an antioxidant?
Yeah. So the current theory of aging really revolves around oxidation and inflammation, right? And so it's not surprising that again, the MyVitalC formula, where the rats live 90% longer, so had such an extreme extension of life result, is a known antioxidant. So there's actually one study that shows it to be an antioxidant 172 times more powerful than vitamin C. Yeah. And when I start talking about inflammation, unfortunately, I have to be very, very careful, because for whatever reason, the FDA has decided that inflammation means disease. And so I can't come on here and say my product, I can't even, it's very risky for me to even share that my product has helped people who have arthritis or Alzheimer's or dementia. It's very risky for me to say those things, because those are specific diseases, and the FDA is very concerned about that. And I think they should be, right? I don't have results. I've got anecdotes, but I don't have results that support those statements. They believe that inflammation is a disease. We know that is so unbelievably debatable. If you just go exercise vigorously above your normal exercise, you will feel the pains of inflammation, and you know that those are not related to a disease. So inflammation is in fact does not equate to a disease, but they've equated it. So the best I can say is that our product fits naturally in an anti-inflammatory diet, right? Hopefully everyone's reading between the lines. And anti-inflammatory diets are known. So the Mediterranean diet is probably the classic anti-inflammatory diet. It's known the population that has this Mediterranean diet is known to have reduced incidences of Alzheimer's, and they're known to be in this kind of blue zone, which is an area where people tend to live a lot longer than the average human on the planet. So those are two of the kind of key mechanisms that has been put forth. We don't know exactly. We also know that the ESS60 molecule is a nanoparticle and does get into the mitochondria. The mitochondria is, of course, the powerhouse, the power engine, the furnace of all of our cells. So you got a mitochondrial packet in everyone, for lack of a better term, in every one of our cells. And actually the ESS60 molecule can get in there. If you had a room of kind of mitochondrial experts and you ask them, hey, would it be great to have a free radical sponge, an reactive oxygen species sponge inside the mitochondria while it's doing its ATP processes? Most of them would say, yes, that's a really good idea. Then if you mentioned ESS60 molecule, kind of the whole room shuts down because they either don't know about it or it's too risky to have an opinion about it in a medical community. So those are some things we're going to continue to know, to understand this. You mentioned senescence already. My director of research really has a theory that maybe it's, yes, we've got a petri dish, it's an antioxidant. We know that it has the ability to hold electrons, which is really kind of this absorption of the reactive oxygen species. But maybe it's actually doing things like stressing the body, right? So we know that stresses like calorie restriction or intermittent fasting even can help get rid of zombie cells, and that can help support senescence or getting rid of senescent cells, if I'm saying that right. So is it actually putting a little bit of stress in the right ways so that the body goes, hey, by the way, if nobody knows out there, these zombie cells are cells that used to be productive and used to add value to your body, but have been damaged enough, right, through time and potentially oxidation, have been damaged enough so that they can't do their complete job. So your body is still left with having to feed them. It's kind of like the worker who stops working. You're still paying the worker, but the worker's not adding any value. And you can imagine as this accumulates, that drags your body down. Theories about calorie restriction are your body's in kind of starvation mode, literally in the case of calorie restriction. And it's like, I have no time for any sort of cell that's not giving 100%. Let's kill it and move on to the next cell. And so that's a kind of an internal theory here.
So basically you're talking about apoptosis, which would be a very interesting study to look at. Can C60 cause the body to start absorbing cells that are not doing its own job anymore? They're too old and broken down to continue to function properly. Mitochondria is actually a very central target of anti-aging therapies these days. There are some supplements that target the mitochondria and all that stuff, but yeah, it does. From what I've read, it does appear to penetrate the mitochondria. And again, part of the deal of being alive, as I like to say, is every time you breathe, you make billions and billions of free radicals. And one of the theories of aging, as you really pointed out, is too many free radicals. We can't deal with them naturally, and so they overwhelm our natural processes, damage our DNA, et cetera. One of the things I saw today, and you're probably aware of this study yourself, I just happened to come upon it, about an hour or so ago. Apparently, at least in a mouse, they were demonstrating that C60 ramped up glutathione production. And maybe catalase.
Yeah, that one, I haven't read that one. I'm sure my director of research has, so I probably need to get a little bit more information on that. But yeah, if we're talking, let me give you kind of a perspective again, nanomaterial scientists coming into 2018. No, I like to say that people become a supplement person, right? Someone who sells supplements typically one of two ways. One of them is they wake up and they decide they want to be wealthy, and the way that they're going to do that is they're going to sell supplements. And I have no problem with people being wealthy. It's not how I ended up here. The other is they either have their own health problem or maybe the health problem of a loved one, and they figure out the right supplementation regime to help with that health problem, and now they want to save the world. Hopefully it doesn't surprise you. I have no problem with people saving the world. That's not how I ended up here. I've been producing this buckyball, again, holding up the buckyball molecule since 1991, selling it into research institutions. They're doing kind of fabulous research on this molecule that is someday going to be ubiquitous. And then in 2012, the scientists even thought it would be toxic, and the rats live twice as long. And now I'm a supplement guy. And so for most of I usually say about 9 months of 2018, when I would answer the phone, customers would call us. And at the time we were marketing, I've got one of the bottles here, and actually they're in the picture behind us, but this was the sum total of our marketing. Like, it's very sciencey. It's not pitchy. It's not saying you're going to live longer. It's not saying anything. Like, it says nothing. There's no real opportunity for placebo effect, right? And people were taking it and giving us calls and telling us things like, I've got hair growth, except it's coming in dark. I've got, my knee pain is reduced. I'm sleeping better. That's one of our most consistent testimonials. So when we came out with My Vital C, everything that My Vital C has on it that it says it does is not because I woke up and decided to make some sort of supplement that does those things. It's because we put something on the market that said nothing, and our customers came back to us and said, this is what it's doing for me. So if you're talking about glutathione and the benefits of that, I just don't have any doubts anymore, because for that first 9 months, like, of course I believed them. You're a human sharing your experience with me, but I'm a scientist and I don't have data. So I struggle with that type of information.
Yeah. Along the same lines with the research, we've been talking about the 2012 study and a couple other studies. Well, they've been on the rats. Is there anything playing with humans coming up? Because that was, we're on 2020 right now. So
yeah. Well, if you think about the science, yeah. If you think about
the human research, I gotta say.
Yes, absolutely. I think other than the guinea humans that are out there, right? The biohackers that are kind of spearheading this, myself included, right? So I've been taking this in earnest. Taking my typical regime is, we've got an MCT product. I'll put the MCT product in my coffee. In my coffee, it's kind of like a bulletproof coffee experience, right? Except it's got my molecule in it, the SES60 molecule. Then I'll actually have like a teaspoon and a half. Really, I take a teaspoon and a half because it's the big spoon in my kitchen, and I measured it once, and it's a teaspoon and a half. And then I'll actually take and that's of the olive oil product, which has the highest concentration of ESS60. And then I'll put our olive oil product on my salad for my lunch. So that's kind of that. Go ahead.
I was going to say, and that's all great. When I was, again, perusing all of this research, and I basically spent most of yesterday reading all this stuff and refreshing my memory and learning new stuff. But why isn't Rice University all over this? They got the Nobel Prize. They're in Texas, which is where you are. I'm a proponent of doing research with universities where they have a budget. They've got a whole population of people who can test stuff and do it for free. Why isn't Rice University and some entrepreneurial grad student looking at this? I'm shocked that they're not actually publishing any research on their molecule.
Yeah, I can only agree and share this with you, right? So scientific processes typically have a theory. The theory was toxicity, get a result, not toxic, actually extended their lives, and then reproduce that result at another lab, right? It can never be the same lab because they're obviously incentivized from an intellectual, hey, I want to just say that my initial publication was true. Nobody stepped up to do that. We are actually stepping up to do that. We've actually signed the first invoice or paid the first invoice in order to get that process started. So we're actually going to reproduce that rat study. We're going to do a couple of changes. One of them is we will start at month 10, but we won't stop at month 17. And one of the reasons is because we know that rats actually like our product. We know that we have pet versions of our products. The cats like it, the dogs like it, and owners tell us good things about the results that their pets are getting. So we can put it in their food. And so that's just a equation of saying, is the dosing right going into the rat? The next is I am working on, I don't know if you can see this. This is an Oura ring. I don't know if you're familiar with Oura ring, right? It's supposed to be one of the better sleep trackers on the market. I'm in contact with an associate professor at the University of California, San Diego, who is actually a consultant for Oura ring. So he's got access to the back-end data. We've already got a study going. We've got about 13 participants. I'd like to get it up to 25 participants where we're tracking 10 days of sleep not on the product, 10 days of sleep on the product, and then back off of it, and then back on the product, so that we can have this understanding of, is it impacting sleep? Because most of our customers say they take it in the morning, they've got mental focus and energy during the day, and then better sleep that night. So we just want to start getting some data. I think some of the reason that you might not see human trials is most human trials are in pursuit of a drug. It is my hope that this never becomes a drug. Because once it becomes a drug, then there's all sorts of regulations that get involved, and the access that people will have to it will be significantly diminished, right? So it's really not a good thing for ESS 60 to be labeled as a drug. And really, we're not seeing any pronounced results. Like we don't have any particular studies that are showing that it's having drug-like value, right? Additionally, big pharma is not interested in something that they can't patent typically, right? So if they can't protect the technology, then they're not going to pay the hundreds of thousands up to millions of dollars in order to do a human trial. So I think that's part of why this is not going on. I don't know, and I'm constantly like, I am pulled in a million different directions, but every now and then I kind of peel off and like, well, let me look into like what a human trial might look like. Let me look into, again, we're already moving down the direction of the rat trial. Let me look at what these things look like. And no like obvious university is like, oh, here's the obvious university. We just need to go there. They've got access to test subjects. They're willing to do it. My current goal is get this sleep study. I actually have Shell Oil interested in, once that study is complete, they might be interested because fatigue in offshore facilities is, and I'm in Houston, so obviously Shell, there's a close partner, neighbor, we're neighbors. The fatigue on oil rigs is a challenge for the industry, not just Shell, but the entire industry. So if we've got some good data, when we get some good data, they'll be willing to do so. They also have kind of their own criteria for assessing how tired somebody is. So they'll be supporting that, and that'll just keep moving in the right direction. So I think the only C60 company out there that's actually doing what should be done with the supplement. And I think you're right. In a lot of, well, if you didn't say this, maybe you thought it, that a lot of supplement companies are in the position where they should be driving some research, and a lot of them don't. And we are. But again, that goes back to our research pedigree.
Yeah, well, a lot of supplement companies are companies on paper, and they're not a brick and mortar organization like you guys are. So yeah, I'm just a big fan of just reaching out to entrepreneurial grad students and say, hey, let's see if product X will lower blood pressure. Let's see if it'll lower cholesterol levels or whatever. Just get the ball rolling with that. I don't know. It's something to think about. I wish I was still in grad school. I would be testing it for you.
So one interesting thing that I hadn't really thought about the best way to do this. We do actually get good testimonials as it relates to alcohol consumption. So people waking up and going, I should be in a lot more pain than I am. I actually went to a conference in Las Vegas before this all shut down, and gave it to a number of people, and then checked in with them the next day, and they're like, yeah, I should be feeling a lot worse. So if we've got college students, I don't know, there's alcohol, college students, there might be some sort of, I certainly, if it lands in my lap, I'll figure it out. I'll keep my eyes open for what kind of possibilities that we might have there, because that is, again, one of the testimonials, one of the anecdotal pieces of information that we have.
One thought that just occurred to me off the top of my head is, send out surveys maybe every 6 months or so to people taking the product. They give them back. You tally all the results. You publish it as a study, and it's, at least move the needle forward a little bit. And gives,
that is definitely absolutely on my list. I've had that in my mind, even shared it with the team. It just hasn't gotten up. It hasn't been upticked enough to actually happen. But yeah, we want to do that. Like, let's get into people's hands when they get the product. What have you noticed about your sleep? What have you noticed about your pain? What have you noticed about your mental focus during the day? What have you noticed about, let me see the right way to say this. Because we get a lot of testimonials that sound like positive impacts on if depression is the right word. Again, I've got to be really careful here, FDA, whatever. But the testimonials are things like, I've got a really good video testimonial from a lady out of the UK who's like, and I think she quit smoking at the time she started my product. And like, obviously, if I'm looking for a testimonial, this is like an influencer. If I'm looking for a testimonial, I was like, no, let's not quit smoking and give me a testimonial about my product. That seems like, not like, at best, maybe they'll cancel each other out. But her testimonial is actually pretty good in the middle of quitting smoking. And she actually uses the phrase, I have a longer fuse with my kids, right? Well, that's about, and I think really the long and short of this is probably more related to, if you sleep better, then like everything is better. Sleep helps your mental, physical, and emotional well-being. So if we're just helping people to sleep well, then we're having a significant impact.
Right. So we know this stuff, C60, ESS C60, gets inside the cells because it's a nanoparticle. How long does it stay inside of us? Do we know that answer yet?
So there's a lot of, certainly in the community is like Facebook or whatever. Well, let's look at it from two perspectives. I think the general answer is 14 days or so, like 2 weeks, this will get out of your body. How much do I believe that? Well, I just look back to the last rat got its last dose at month 17, should have died around month 32, which is, that's 15 months later, right? But actually lived out to month 62, right? So what is the impact? Is it possible that it had some sort of impact and then got out of the body? Certainly possible. I don't think that makes logical sense. So I think there is some, but remember, if you've just got one buckyball per cell, that could have a potential significant impact, and you would probably not be able to measure that. I mean, you would have to like take the whole creature and then dissolve it in toluene and inject it in HPLC, right? So it's possible that there's some amount sitting there. I don't know the real answer to that. I don't think anybody really does. The general consensus is that it gets excreted out of your body in about 14 days.
Okay. And obviously no urine test to measure it in the urine, I guess.
Yeah. Well, yeah. So the reason that you can't do a urine test, it has to be feces, is because the ESS 60 is not water soluble, right? So it won't come out in your urine, right? It'll only come out in feces.
Oh, very good trivia to know. Now, when people ask me a question, how much do you take of this stuff? And when I looked at the research, I saw 1.7, milligrams per kilogram, and I said, we've actually a great question, because if somebody's reading that study and they see 1.7, milligrams per kilogram, and they start doing the math, you got to do a little bit of math calculations to convert the human dosage. So
yeah.
What is the current, the appropriate dosage for a person based on what we know from the mice studies?
Yeah, so the straight calculation from that original Paris rat study to a human would be 1 cup of olive oil with ESS 60 per day. 1 complete cup. Obviously, that's not what we want to go for. This is actually something that I had to learn, coming into this and saying, okay, well, how are we going to define this? There's a thing called an allometric calculation. And an allometric calculation is like, hey, takes into account the fact that there's a different metabolism. Rats have a very different metabolism than humans. And my educational background is mechanical engineering. Engineers tend to like think about, big circles, like imagine a spherical chicken is actually a mechanical engineering joke at one point. So what's fascinating is one of the ways that you can equate metabolism or compare metabolism is the surface area of the animal. Right. So when you take into account the surface area of the animal and do this allometric calculation, you end up with right at 5 mils, which is 1 teaspoon as a serving size.
Okay.
And we do actually on our website, so you can go to myvitalc.com and get to the calculator. Actually, we have a link for you, which is myvitalc.com/JPC. And then you can click the link to our calculator. And at that, you can kind of enter your weight and see, how much is really the right serving size for you.
All right, that's a really good idea. And since maybe this stuff stays in your body for at least we don't know, but an extended period of time, could someone take it maybe, every other day or something like that? Do you have to take it every day?
So here's what I notice. If I'm in the middle of the day, and this is a lot of people around me, if I start yawning like late in the afternoon or even in the early afternoon, I usually can look back and remember that I didn't take my product, right? So I think you can, it's conceivable that you could take 1 teaspoon, right? If we look at the rats again, and this is, by the way, not good marketing for me. So, maybe this gives some credibility to me because I'm comfortable saying these things. Again, I'm not supposed to sell a supplement. Like, I'm supposed to be a nanomaterial scientist. If the last rat got its dose at 17 months, right? And then that still extended its life out to 62 months from 32, right? It's possible you could take 1 teaspoon of this stuff and you're good. I mean, that's within the realm of possibility, because if it's stuck with the rats for 30 months after they had only been dosed for 7, I don't think that's the case. I certainly, I feel that there's a difference. And again, when I say, if I'm in the middle of the day and I'm yawning, like, I know I haven't had my product. The same thing is for my wife. Yes, that can be placebo. Yes, that can be just kind of our circle of friends. But we do know people who have gone off. In fact, one participant has already gone all the way through the sleep study, which was 10 days off. Give me the data, 10 days on, 10 days off. And when he went off the product, his sleep kind of regressed. And when he was on the product, his sleep was better. And so, maybe you live longer, but you're groggier, or, so I just tend to take it daily, and I do feel that there's a difference. I can tell you this, because I got the Oura Ring, obviously I need to participate in my own sleep study and provide data, which meant I had to go off my product. 2020, before we got all crazy, right? We got January, February, and March. I had a very busy, I've actually been to LA twice, Vegas twice, Nashville, and I think one other place. That was all crammed in the first 2 to 3 months. And I was like, I am not going off of my product while I'm on these trips, right? So I actually went off in March and was off it. I think I went off for about 20 days. I'd have to pull up the data. But I actually got a migraine when I was off my product. And I haven't had, so that's one of the testimonials, one of the stories that I tell. I'm very much I want a black and white testimonial. Since 2014, I've been collecting my own migraine data because I'm trying to figure out why I get migraines. Is it, did I have a fight with my wife? Did I drink too much the night before? Did I exercise? I'm just trying to, did I eat whatever pickles? I'm trying to figure out why I'm getting migraines. And so from 2014 through 2017, I was getting 4 to 5 migraines per year. Not very many. Like, I know there's suffering. In fact, my wife is, and I'll tell her story in a second. In 2018, when I started taking this in earnest, I didn't get a single migraine for the entire year. And then coming into 2020, I actually went off of my product for 10 days and got a migraine then. Now, that's pretty binary, but I'm also a scientist and going, yeah, this is kind of a stressful year, and lots of really weird things are happening. And so, is it fair to say it would have happened off of my if I were still taking my product? I don't know, but the data says I went off my product and I got that migraine. In my wife's case, she was getting 9+ migraines a month. She actually had a medication where they would only give her 9, like any more than like any migraine after number 9 that needed medication, you just had to suffer through or just use Tylenol. And she went down from 9+ to like 1 to 2 per month. So again, these are fairly binary pieces of data. Like, when I'm not on the product, I get migraines. When I'm on the product, I don't get migraines. And so I'm fairly comfortable sharing that data.
Have you had any testimonials about tinnitus, ringing in the ears, if it helps it or not?
I've seen on Facebook a couple of people asking the question, and I'm trying to think if I've seen. So personally, no. And if I don't share any testimonial that I can't track back to a person, right? Although I do know people, more than one person has asked about it on Facebook. I don't recall the answer on Facebook. So obviously that would be something you could go check. So I don't know. I don't know.
That might be something I'd be interested in myself, because I've got it in my left ear. I've had it for a few years now, and it's annoying, to say the least. So when I look at a supplement, I start thinking, tinnitus? Is this something? Because I've tried almost everything under the sun. I'm like,
yeah.
And when you might said migraine headaches, I thought, oh, maybe tinnitus is up there.
Well, how about this? How about I send you a couple bottles? Well, when we wrap up this broadcast, I'll send you a couple bottles. And if it makes sense, you can try them and we can actually maybe get back together and talk about your experience. And, again, I'm a scientist. I'm not supposed to be selling a supplement. If you're like, it didn't help with tinnitus, then I can go to my little lab book and I can say it does not help tinnitus, right? Like I'm comfortable with that.
I would be willing to do that. I will be a guinea pig. I'll try it for the tinnitus. I'll actually keep some logs and how I feel. If I have any, aches or pains, or if I sleep better. So I'll be glad to help you out with that. Yeah, I don't have a problem with that at all.
Great. We'll make that happen.
Cool. Appreciate it. Other questions people would ask me, does it have to be refrigerated? How does it taste? You've already kind of said that. You get that peppery taste. And do you have to take it on an empty stomach or with food?
So let's talk about refrigeration. So we get calls at 2 parts of the year. When it's really hot, we get calls saying, hey, this was out in the sun on my porch for the afternoon. Is that a problem? Also, it was in the FedEx truck, on the way here. Is that a problem? Just like regular olive oil gets transported places and reaches high temperatures or truck temperatures. It's not typically shipped in a refrigerated container. Do you want to leave it on your front porch for weeks and weeks and then actually even open it and leave it out there? Absolutely not. Treat it like an olive oil. The other extreme is in the winter, it'll actually coagulate, right? So it's an oil, so you'll end up like, it'll solidify. So we get calls like, oh, I think there's something wrong with it or whatever. Like, no, just let it get to room temperature and then it'll actually go back. The oil will melt again and it'll be back to normal. So temperature, not a problem. Okay. But just treat it like regular olive oil. There is actually some research that supports that the ESS60 antioxidant capabilities is beneficial to the oil. So in that original study, I'll be honest, I haven't seen the comment. I've heard people talk about that there was oil left over at month 62 that was still good, right? Typical olive oils go bad in 3 years, right? So we're talking about a 5-year-old, obviously opened oil. It was mixed at one point. So we are talking about something that's lasted 2 years longer than its 3-year lifespan. So that's that. Do you need to take it with food? In reality, olive oil is food, right? So it's got its own food carrier. Again, some people, the oil doesn't sit well on them. We recommend put it on bread. Like that works perfectly. But you don't need to take it with food. Figure out what works best for your body. We do recommend, and this is less like my own personal experience is I can take the product now. I can take it right before I go to sleep. But I can also drink a cup of coffee right before I go to sleep. So I might not be the best test scenario. We do have customers who say if they take it too late in the afternoon and certainly at night, some of our customers will say it'll keep them up. So we do recommend that you take it in the morning, and that's with or without food if you want. We are unaware of any interactions with any drug or any other supplement. So we do get that question from time to time. If you're taking a drug, if you want to try this and you're taking a drug that is kind of imperative to your health, right? Like, potentially insulin or whatever it may be, we certainly would recommend that you consult your physician, right? Because if it's a life or death drug that you're taking, there's probably not enough data to say conclusively that it's good. I can just share with you, we're unaware of any adverse interactions with any drug. And we've got thousands of customers. So we probably have customers who are taking it with almost every drug.
All right, that's good. And along the same lines, probably as well, pregnant, breastfeeding, yep. Children would be a no-no. Stop 2 weeks before having surgery in case there's a blood thinning effect, all that jazz. So people not so healthy, do your own diligence, obviously, for all this stuff. And any kind of dietary supplement you're taking. So where is it? So you're in Texas, so I'm assuming the whole shebang is made in America.
Right here.
Good.
Yeah.
I like to hear that. You mentioned pharmaceuticals a little while ago. I read a very eye-opening book last year called China RX, which I have been telling people about ever since I read it. Basically how a lot of medications are made not here, but in other countries like China. I think China makes about 13% of pharmaceuticals, not only generic, but also non-generic drugs as well. So, and I started looking into the whole supplement thing. A lot of supplements are not made in America either. So, so you're made in America. Excellent.
Yeah. In fact, we, in mid 2018, we actually started selling so much oil that we were taking all of our own production of ESS 60. Well, one, we actually stopped selling the industrial grade C60 for a while. Everything was being processed to ESS 60, and we stopped selling most of our ESS 60 into the market. And we were like, well, maybe there's a solution. So we actually visited China. We actually visited different manufacturing facilities because, at the time it's on the table. Hey, there's a market here. Let's look at it. I think there are general concerns about China. There's the one that really resonates with me is in baby formula. They put, the thin, I forget what the thin board that you put on kitchen counters, right? So that material in baby formula would increase the perceived protein count. So they were actually selling like lanolin, something like that in baby food, like for babies. So that makes people, certainly me, very nervous. And then we actually tested the material and it really didn't conform. And we could have taken it and processed it. But, when you have control of the entire production process, you're not worried about, I don't know, arsenic being in it, or you're not worried about like other crazy things being in it. So you kind of don't test it. Like every now and then you pull off a sample and you want to just make sure that your carbon rods are carbon. But the reality is if we were to go down that path, and ultimately we decided that it wasn't in the best interest, and we lost money. And in fact, I think there are producers of kind of C60 and oil products right now who used to buy from us and are no longer buying from us, probably because of that decision. They found a slightly cheaper source. It's not appreciably cheaper, but in my opinion, it's a riskier source. And so, we make it here, we mix it here, we actually bottle it and label it and ship it from here. And we've got, 300, I don't remember what the count is, a significant amount of 5-star reviews on Google about both the efficacy of our product and the customer service that we provide.
Outstanding. And I actually have called your customer service. I actually said that in my original review a couple of years ago. Very, very, very knowledgeable, very friendly. Pick up the phone, and you're definitely talking to somebody who is in Texas. I could hear the Texas, the twang in the voice.
Did you speak to a man or a woman? Do you remember?
I believe I spoke to a woman.
Yeah, it was probably Cassandra, and Cassandra runs our customer service department. Obviously, we were smaller back then, and so she still answers the phone, but not as much. And she's just phenomenal. Like, yeah,
very, very
she's the reason for our 5 stars.
What does ESS stand for, by the way? You mentioned a couple seconds, I like words myself.
Yeah.
My dad. What does ESS stand for?
So elemental safe spheres. You could actually say elemental carbon, and then safe spheres, and of course 60 is the 60 atoms. That is that elemental carbon.
Gotcha. So there's C60 and there's C70. Somebody brought up the other day. Is C70 better than C60?
So
it's kind of like a crazy question, but I'm like, well, I don't know.
I think it's a great question, right? I wonder the same thing. What I can tell you is I won't put C70 in my body to find out. I would like to do at least a rat study. I don't know, like a rat study on C70. I know at least one organization in the UK that is mixing C70 and olive oil or whatever oil and selling it. And that falls into, I'm just going to say, an uncomfortable, if you're comfortable taking that, it's because you're not aware that there's no research. And you're saying that a molecule that looks like this, again, I'm looking at the soccer ball, and then we take it oblong, right? So when you add C70, it doesn't just become a bigger sphere, it actually gets more rugby shaped. And I spoke at the beginning where when you're doing synthetic hormones, they can have different right angles and left angles on them, and that can have a significant impact into how your body reacts with them. This has a different shape. If you haven't done a rat study or a mouse study or any study, and they haven't been done on C70, one, because it's so expensive, and two, it hasn't been on anybody's radar, then I would never put it in my own body. And I think it's kind of unconscionable to sell it in oil.
it was a great question because I didn't see really anything on C70 either. So I was like, it's a good question because I honestly couldn't tell you. I didn't see a lot myself on it.
Is it possible that it's as good? Is it possible that it's better? Absolutely. Is it possible that it's toxic? Absolutely.
Interesting. So you mentioned there's a lot of other suppliers out there, and if somebody is out there, they're trying to evaluate a company that's selling this stuff, what are some questions they should be asking themselves and also the company before they invest their money, in some sort of a C60 product?
So yeah, I think the answer might be a little disappointing. We actually get emails and phone calls. Hey, is this product good or is that product good? And my typical response is, well, if you trust us to assess the product and you're going to put this in your body, you probably should just buy from us, right? That's probably the right thing to do. I bought about 20 of the products on the market. Here's the problem. So first off, there's companies out there that have a PO box and not a real business, right? I would not recommend you buy something that you're going to put in your body from a PO box. There's one here in Houston that actually, it looks like an address, but when you Google it, it's a post office and it's a PO box. And they've got a number of C60 products. But we tested their material and it's not what it says on the label. That's the other thing is, even if you can call them, what are they going to tell you? They're going to tell you that what's in their product is exactly what's on the label, right? But we tested it, and for every other brand, what it says on the label is not in the bottle, right? There's actually one brand that actually has a higher concentration than what's on their label and a higher concentration than actually we have. The challenge with that particular company is we used to sell them C60, not ESS 60. This is back in early 2018. They were buying C60, not safe ESS 60 from us. We realized they were putting it in oil and selling it to people. And we had a phone call with them and said, you cannot buy this. We will not sell you C60 for industrial purposes to put in oil. You need to buy ESS 60. And they decided that that wasn't for them. So they knew what they were putting in their product and they continued to sell it. Now, the reason I tell that story is they're probably buying it from China. And if all the solvents have been removed, the presence of toluene can actually increase the solubility of C60 in the oil. So I think that the fact that they have a higher concentration is indicative not of a better process or anything, because they don't have, in my opinion, they don't have the ethics associated with that. They probably don't have HPLCs. Who knows how they're making their product? But it's, it makes sense from the context. If you're going to buy an industrial grade C60, more is going to go in solution.
Okay. Interesting stuff. So again, that's kind of bringing us to the end of our interview. Chris, this is great. How can people find out more about you?
Well, the best way, and I'm so glad that you did the video so long ago. I kind of reached out to you and said, hey, that was about a year ago, right? Let's connect. You finally did reach out. I really want to support what you're doing. You're obviously approaching this from a very kind of scientific perspective. So if people will go to myvitalc.com/JPC, then that's Joe Peter, was it Peter? Joe Patrick Cannon, JPC, they can find our products. What I would recommend that you do is scroll down the page. We sell individual bottles and we offer about a 20% discount on subscription. So go ahead and go on subscription. Our 5-star customer service has not been trained to talk you out of getting off of your subscription. So if you want to cancel at any time, you'll call them. They might ask you a few questions, but they're not trained to harangue you until you don't. They would just want to understand, if you've got any benefits, how long you've been trying that, those types of things. But you can cancel at any time. Please take advantage of that discount. We also have a coupon code, and the coupon code is JPC, and it's good for $15 off of your first order. And if you go on subscription, it's $15 off of that first subscription order.
Excellent. I'll link to that in the description of the video as well for people seeing this in the future. So this has been great. Chris Burres, SES Research, MyVitalC, myvitalc.com. I really appreciate you spending time with me today. again, my very first video on YouTube for my podcast. So you have that dubious distinction.
Well, thank you so much, Joe, for having me. And thank you. Like, you got me the questions. They're thoughtful and scientifically intelligent questions. I really, that's really refreshing. And I want to support what you're doing. Go to the myvitalc.com/JPC link.
Excellent. Thanks, Chris. Appreciate your time. All right. It was good, man.
Yeah. Very good. Thank you. That's very good.
Yeah, I appreciate that.